Hello, my name is Charlie. I received a heart and kidney approximately 1 year and 8 months ago. My journey began on July spending the day offshore fishing. We were in a fishing tournament about 100 miles offshore in the Gulf when I started to feel chest pains and shortness of breath. We made it back to shore, and I thought I just needed food and rest. I went to sleep and woke up the following morning still not feeling right. I pulled our fifth wheel camper down to the bay house, which is about 2.5 hours from home. I had to pull it back to the house whenever we were done fishing the following morning, which I live about a 2.5 hour drive. When my wife noticed my condition after I went inside, she noticed something was off. So she gave me two options. Said either she was going to call an ambulance or she was driving me to the hospital. After being admitted, I don't remember much of anything for about the first 5 weeks of my stay at the hospital. I'd already endured a quadruple bypass procedure, beat pneumonia, had already gone through two stents each of the ECMO and the Impella device, which supports your heart during heart failure. I was bedridden and knew I was sick when I couldn't move my body. I lost over 60 pounds in that time frame. I fought every day upon learning what I'd already gone through. I stayed in the ICU for 92 days from the time I was admitted until the time I received the gift of transplant. I knew that if transplant wasn't an option, I most likely wouldn't leave the hospital alive. Before my transplant, my life and health were never an issue. I hardly ever got sick, but did deal with elevated blood pressure. I played baseball growing up and through college. I've always worked hard and enjoyed the outdoors. My hobbies included baseball, fishing, golf, hunting, spending time with my wife and two kids, along with my friends and family. After being in the hospital for the first 3 months, transplant was the only option for survival to extend my life. Since my transplant, I have not experienced many complications. My biggest issue was healing and getting stronger after being bedridden for 4 months while I was in the hospital. I left the hospital in a wheelchair and had a walking device to assist with short movements around the house. I worked so hard with the in-home therapist that came to my house and then the hospital physical therapy sessions that were provided to me. By the time I was released to drive after 3 months post-transplant, this was about the same time frame that I could drive myself to the hospital, physical therapy sessions. I found a sense of freedom once again, being able to drive myself to and from where I needed to go. The most challenging part of my transplant journey was to get well and stay healthy post-transplant. I had to learn to protect myself in certain environments. This includes wearing face masks on airplanes and enclosed environments around a lot of people. I had to learn to stay on top of my medications and anti-rejection pills. I have to make sure I'm doing everything the doctors advise me to do. I have to watch what I eat and what not to eat, like sushi or raw meat, how my steaks are cooked, which now have to all be done well done rather than medium. The medium style I chose prior to getting sick. Basic things that I never thought of before, but now I have to use caution when it comes to the food consumption. What helped me stay strong and hopeful while I was in ICU waiting for the call for transplant was my faith and trust in God, my wife and kids, and other family members who never left my side. My friends who were there for me along the way, the doctors, nurses, therapists, who all did an amazing job in taking care of someone in the condition I was in. My will to live and my hope to get out of the hospital and see my family and friends outside the hospital again. My dog's sitting on the back porch and enjoying the blessings that I've been blessed with in my lifetime. My will to live was stronger than my will to give up hope. Since my surgery to get well and stay healthy, I had to fight every day to get stronger through therapy and physical exercise. I had to change my eating habits and stay away from certain things like buffet style dinners that might be contaminated with bacteria that can make me sick. I can only eat well done meats now. I have to cook on the stove deli style lunch meats before consumption and make sure I stay on top of my medications both morning and night. Everything I do now and moving forward, I must do to protect myself from environments that may put me at risk on catching illness since my immune system is suppressed. When I received the call and learned of the donor match, it was 2 a.m. in the morning on a Saturday. The transplant coordinating team member that called me gave me the age range of the donor that I had been given, and I needed to either accept it or move on to the next. I immediately accepted it, as I knew it was probably my only chance for survival. I immediately felt joy and relief that my time was possibly near for a new chance at life. Surgery began approximately 36 hours after taking that call, and I was at peace, knowing that either way the outcome, this was the right choice. My recovery began almost immediately after transplant. I was out of bed within 4 hours of being woken up post surgery from the nurses and therapists. From there, I fought every moment to get stronger, every moment of every day, so that I could resume life and enjoy everything that I enjoyed prior to getting sick and needing a transplant. Advice I would give someone going through the transplant evaluation process or waiting for that process to begin would just be to trust the process. Trust your doctors, nurses. Have a strong support group of family and friends that pray for your situation, and have hope in your trust, in your faith. Fight for your life every day and make changes in your life that affects you positively and others around you. I hope this helps. Good luck to you.